seems to be no end in sight to the health crisis there. Last month, a group of doctors said patients are suffering because of the ongoing health strike, saying that the death toll could be worse in time than the Life Esidimeni tragedy. They're demanding urgent action. We're now joined on the line from Bloemfontein by Kevin Halama, who represents the Health Workers Union, Hospersa. Good afternoon to you and welcome, Mr. Halama. First of all, just in terms of Hospersa's representation at institutions in the Northwest Province, how widely represented are you?
Good afternoon, Jeremy. In terms of the Northwest, we have quite a substantial membership there. However, a majority of the members that are aligned to any trade union, they are aligned to the union that is currently on strike, that is currently on a labor unrest. But we do have quite a substantial number of members in all the hospitals. For instance, like at Potchefstroom Hospital, our provincial chairperson is based in that hospital, and we enjoy quite a huge amount of support from the members there.
Are all your members at their posts right now?
It will be very difficult for me to say with conviction that all of them are at their posts, because they have succumbed to intimidation when trying to go to work. I mean, for instance, in Klerksdorp, we've received reports from our members that work in various clinics in Klerksdorp that they aren't able to go to work because they're intimidated from attending to work. So this has been ongoing since the beginning of the week.
Do you share the view expressed by some that if this continues, and it's been ongoing for some time, that it could have the same type of consequences as Life Esidimeni, or is that over-amplifying it slightly?
I think the results will be more disastrous than Life Esidimeni. I mean, if you look at the number of facilities that are currently closed due to the unrest in the province, that just tells you the severity of the problem. So I think we are looking at something more than Life Esidimeni here if the issue is not urgently addressed.
To the best of your knowledge, have any direct deaths been attributed to the industrial action so far?
Not to my knowledge. However, what I can say is that because there's a labor unrest, it deprives medical attention for patients that urgently need it. I mean, for instance, if you're a patient in Klerksdorp and you can't visit any nearby clinic, it just limits your chances of getting medical attention. So we're totally against the labor unrest that has resulted in the closure of these clinics, because it's depriving medical assistance to the patients that desperately need it.
How do you think this can be resolved then?
I think the health issues have now been overshadowed by the political issues in the province. The mere fact that the Premier has postponed his resignation, it takes us 2 steps back, because I would have thought that his resignation would have ushered in a new administration in the province that will actually address the critical issues that exist in healthcare. I mean, there's a vast corruption and maladministration in the Department of Health in the province. But at least with the Premier stepping down, I think that would have been a starting point to get the union that is on a labor unrest to go back to work, and then let's work on the health issues that affect the Department of Health. But now we can't do that because the Premier stands and he's holding the province at ransom.
What is your understanding of the maladministration? How is it manifesting itself, which is resulting in this crisis that you're outlining?
I mean, there's a number of dodgy contracts that have been awarded in the Northwest. I mean, if you look at Buthelezi EMS, they've received multi-million rand worth of contracts to run EMS services in the province, while you have a number of ambulances that lie stationed in the department's provincial offices. And then never mind the Mediosa issue, because that also another issue that was brought up as one of the most corrupt tenders that was issued. So the system is really corrupt, and it needs to be investigated. I mean, that's something that is out there in the public eye, and it needs to be investigated.
What pressure is Hospersa trying to bring to bear on the situation?
At the moment, because our members are totally against the labor unrest that is taking place, what we've done, we've written to the president. We first wrote to him on the 16th of April, and we received an acknowledgement, and a ministerial task team was sent to the province. But now our challenge is that ministerial task team is only meeting with the union that has the striking members, but is not meeting with the union that wants to bring change into the province. Hence, we've rewritten now another letter to the president to ask for his intervention, but on a political side, to ensure that the premier is possibly removed, because that is the only way that I think we can move forward with the situation in the Northwest.
Are you in any way able to engage bilaterally with Nahawu?
We have tried. I mean, at first, when the health issues started, we were fully supportive of the issues that were brought to the table. I mean, we even sent a memorandum of demand to the Department of Health in the province. However, because the political unrest has taken over, it has overshadowed all these health issues that are taking place in the province. That's why we feel that the first step is to address the political unrest, and then the health issues, I think it will get Nahawu to get back to the table much faster than now, where you have a premier who's not willing to budge.
Given the urgency of the situation, as you've just outlined, with lives at risk now, why are you simply not seeking legal redress here?
Why are we not seeking legal redress? I think on our side, you mean we have Nahawu, who's the majority union there. I mean, for us to seek legal redress against Nahawu, who's on a labor unrest on genuine issues that members are complaining about, or legal redress with regards to the Department of Health. I think the Department of Health is the one that needs to be blamed here, because they've allowed the situation to escalate. When the strike started 2 months ago, these issues should have been addressed. But now the issues have been overshadowed by the political unrest, which is something that the ANC in the province needs to address. So right now, doing a legal exercise is merely going to, we feel it's not going to really address our members' issues.
The fact that the department is under administration, is that helping in any way?
It's too close to this. It's too early to tell. I mean, it's only been a week. And judging from the reports from our members is that they haven't been consulted by this ministerial task team. It's only consulting with the majority union. And from what we're seeing is that the situation continues to deteriorate. Hence, there's a number of hospitals and clinics that have also closed down their doors since the beginning of this week.
All right. Thank you very much indeed, Kevin Halama from the trade union Hospersa. Well, he was talking about that interministerial task team. I can tell you it will report back in the coming week on its assessment of this increasingly difficult situation in the Northwest.